Time now to ask the expert. Here to answer your questions live on air is Dr. Natasha Bhuyan, and we're talking about medicinal mushrooms or psilocybin. So our first question is from Joe in Scottsdale. Is it safe?
This is the most important question we should ask. So before I prescribe any medication, I want to know the safety profile, because there are medicines out there that are effective and they work, but they come with way too many risks and side effects. And the nice thing about psilocybin, from what we know, it actually has a very low potential for addiction. And it has a low potential for overdosing on it. And now, like I mentioned before, there are risks related to the heart. It might not be for everybody, but overall, it has a pretty impressive safety profile if people end up taking this.
Yeah, that is surprising.
Yeah.
All right, Alex from Phoenix says, how are shrooms different than prescriptions to help the same thing? You had kind of talked about this.
Yeah, you know, it's acting on different receptors. So there's these serotonin receptors in our body, and the psilocybin acts on a different one than the ones that we have currently for medications like depression or anxiety. That being said, you know, mental health conditions are really tricky because there are some medications that work in some people, and that exact same medication, it might not work on a different person.
Hit or miss.
And you know, there are some depression meds that work in some folks, but not another class of depression meds. And so I think what we just know is that our own personalized genomics plays a big role in all of this. And so it might not be a one-size-fits-all approach, but it's not the same as medications that are currently on the market.
Okay, so going back to, it's not a one-size-fits-all, and some work better than others on certain people. What about psilocybin, though? Is that, I mean, would that work for everyone?
A wide range of people. So, you know, what we're finding in the early research is it doesn't have the same effect on every single person.
Okay.
So people react differently to
same
it.
thing.
And yeah, and the thing we worry about, of course, is we worry about a bad trip, because there are some people in these trials that they take the psilocybin and they end up hallucinating or having agitation or fear or paranoia. And so I think scientists are really trying to figure out, how do we eliminate those concerning side effects before we make this widely available?
Yeah, okay, interesting. Leslie from Chandler says, is there any proof that this works?
Well, there's only very early clinical trials. So when I prescribe a medication, I want it to be studied in thousands and thousands of people across the population. You know, a trial with 30 people, that's promising and it gives you a little bit of data, but before you make it widely available, you really need thousands of people in trials. And so right now, we're in the stages that we actually just need more clinical trials on this to understand how it does work and who it works in.
Right. Oh, Natasha, excellent breakdown. Thank you so much for helping us understand it.